Hi, I'm Dr. Anaïs Carniciu. I'm a board-certified oculoplastic surgeon here at Seeta Eye Aesthetics. I'll be discussing the latest and greatest technology in dermal fillers, the RHA collection. It's a very natural collection of fillers that I'm excited to offer to my patients here. RHA collection is resilient hyaluronic acid. It's a collection of dermal fillers that most naturally resembles the hyaluronic acid that we have in our bodies. It's very specific in terms of its long chain, which is longer than other hyaluronic acid dermal fillers on the market. So it looks more natural and it integrates better with motion when our faces are naturally demonstrating expressions such as smiling, frowning, or talking. RHA is a very unique type of HA because it's resilient and it's dynamic. So other HA products that include dermal filler collections that are not RHA collection aren't as natural when faces are in motion. So you might have that overfilled look or that unnatural heaviness when you're smiling, frowning, or showing emotion. With RHA, your natural expressions are preserved, so it gives patients a really, really delicate but powerful effect. I really wanted our patients to have options, and RHA is the latest filler technology to be FDA approved in the United States. It's been available in Europe for years, and our patients are very selective and elegant and refined, and we want an option for them where their facial expressions are preserved and it doesn't look like they have filler that's overdone or overpowering, especially when they're smiling or their faces are in motion. And it's a really great addition to our aesthetic offerings here at Seeta. RHA collection is a great option for patients of all ages, ranging from young adults in their 20s all the way through patients that are more mature in their 70s. It offers something for everyone, and with the different types of RHA product, including RHA 2, 3, and 4, these are different thicknesses of product that produce different volume effects depending on how advanced someone's wrinkles are, if they want just a bit of a boost, or whether they want a more powerful result. Maximum results are usually seen a week or two after the injection is performed. So originally, when you have your injection, you might notice some swelling and bruising a couple of hours starting after the initial procedure, and this subsides over the next several days. The maximum results can be seen when all of that bruising and swelling has quieted down. Usually at about 2 weeks is when I have patients come back for their final review with me to see how they like the results. One of the things I love about RHA collection is the results are relatively long-lasting compared to other filler products that are available, and this is because the chain of HA is longer and more naturally resembles our body's own HA. So it takes the tissues longer to degrade the filler product. Many of my patients have results lasting up to 15 months with this filler product. So there's no true downtime with RHA filler collection. A lot of patients will come in during their lunch break and have an injection performed, as long as they don't mind some swelling initially after the procedure is performed. You can return to work the same day unless you do something strenuous for work. Otherwise, I recommend taking it easy for about 48 to 72 hours. No heavy lifting, nothing that can cause too much exertion that causes the blood vessels to dilate and move the product around. Additionally, I have patients stay away from blood thinners like Advil that can thin the blood and cause problems in the post-op period. One other thing to look out for is alcohol. This can also cause swelling in the tissues, so I ask my patients to hold off on any wine or beer for about 48 hours after the procedure. Today we have our lovely patient here who's ready to get filler treatment for the first time in her nasolabial folds. RHA collection filler is a great option for this area because there's an FDA indication for dynamic facial movement and wrinkles that occur in the nasolabial lines, which are the lines in between our nose and our mouth. Those deepening folds that happen with extra birthdays sometimes cause changes in the facial structure, and as we age, they become more pronounced. So today we're going to be discussing some of the indications for RHA filler, including the nasolabial folds, and we'll be performing this live filler injection. So the first part of our evaluation is talking to our patient and finding out exactly what you're starting to notice in your face and what your facial aesthetic goals are. So I'll give you this mirror and just point out what you're starting to notice.
So as I'm noticing more so after I had my daughter, is that the more I'm smiling or the more I'm making facial expressions since I had her, I have noticed these deep creases that are starting to form from between my nose to my chin line that have started to make me a little bit self-conscious, that I was interested in finding out a little bit more about.
Okay, so we're cleaning the face really well. We're just wiping off any traces of makeup so that we have a fresh start here. So this is just an extra antiseptic. It's Purison, and it just cleans everything really well to make sure everything's nice and ready for the filler. And smile for me. Great, we're just assessing where these folds are the greatest. The nice thing about RHA is that it allows for dynamic facial movement, so you're not going to have that puffy, overfilled appearance. The filler really moves naturally with your facial expressions when you smile. I'll have you relax. And this is RHA 4. She has such excellent skin texture that we're able to use RHA 4. A little bit of discomfort. The nice thing about this medicine is that there's lidocaine in the filler material, so they'll start feeling numb after a while. How do you feel so far?
Fine.
Good. So you need very little here. I don't want to overdo it. Smile for me. Great. So we're already seeing how this line is less noticeable. I'm going to fill a little bit over here, just in these little laugh corners. And now for the funny part, I'm actually going to put my glove in your mouth, and we make sure that there's no nodules here. So we really massage all of the material in, and the nice thing about this filler is that it integrates so naturally with the hyaluronic acid that's already in your tissue. The molecular structure is very similar, so it integrates so nicely. Mirror here.
Oh my gosh. So I absolutely love it.
Some of the lines, most of the lines are actually softened here, and we wanted to go for a very natural approach. So some of the deepened folds there are just reduced with the filler material.
Okay.
I only needed to inject about 0.35 cc's into each side, so less than a syringe of filler got you these very nice results without looking overdone and unnatural. So when you smile, you can see that the material moves with you, but you just have softening of those lines.
Absolutely. I absolutely love it. Thank you guys so much.
It's our pleasure. Thank you everyone for attending our virtual event. Just a reminder to stay tuned for the next 15 minutes to ask us questions through the questions box, and I'll be answering them live. Additionally, look out for a text that you'll receive from us in the next few minutes. If you're interested in booking a consultation, reply yes, and our staff will be in touch with you to book your consultation for RHA Filler. It was a pleasure to talk with you all today, and we look forward to seeing you in the office soon. Hi everyone, it's Dr. Carniciu here. Thanks so much for tuning in with us today for the RHA Collection virtual event. It's a pleasure to see you all, even if it's virtually. Hopefully we'll see each other in person soon. And I'm already seeing some great questions popping up here. So we'll start fielding some questions. I have my assistants monitoring everything. So we'll get some questions going.
Okay, so our first question is, can it be used in the necklace lines?
In the necklace lines. So that's a great question. I think that refers to part of the tech neck phenomenon that we've been having lately. So a lot of people, as we're looking down at our phones, we're developing these horizontal lines along our necks and also along our upper chest, lower neck area where our necklaces would normally sit. And that's just from constant looking down at our phones, reading, and using technology. So although RHA Collection Filler is not FDA approved or FDA indicated for these fine lines along the neck, an experienced oculoplastic surgeon, such as myself, are artists of using this material in unique ways that are still safe and can be used for non-FDA indicated uses. And one of those is also the lips. The lips is a place that I inject RHA filler into a lot, and it's not one of the original study sites like the nasolabial lines. So it can definitely be injected there, but I would go to see experienced oculofacial surgeon for those procedures. So that's a very, very good question.
Okay, here's another good one. If I have a special event, how far in advance should I make my filler appointment?
That is also a very good question. So ahead of special events, I usually ask patients that a month is typically the ideal time to place any type of filler product or any type of toxin product like Botox type products into the face. Injectables need a little bit of time to settle to have their full effect. So with RHA Collection, you might have some swelling the first couple of days after your injection. And it really takes about 2 weeks for all of the swelling to come down and to see that nice final result. The filler will be there right after we inject it, but to really go through the healing process and have your face settle down into the final result takes about 2 weeks. At that point, some people want a little bit of a touch-up. So let's say they want a little bit more to their lip, they want a little bit more filling in the nasolabial folds. I always recommend going a little lighter to start, especially if you're filler naive and it's the first time you're getting injections. And then we can always add more at that 2-week mark to get you ready for that special event. So about 1 month out is ideal. It gives you time to have a little touch-up, a little follow-up with me, and it also gives you enough time to heal optimally.
Okay. So we do have some more questions about the different areas that we can use it. So we have someone asking about the under eye area.
Mm-hmm. So that is a great question. And as an oculoplastic surgeon, I'm a board certified ophthalmologist and also certified oculoplastic surgeon with expertise in plastic surgery of the eyelids and the face. So tear trough filler is what the question asker is referring to. It's a very delicate area to inject filler into, and you really need to see an expert for this area because some deformities or anatomical differences of the under eye area are actually not ideal places to inject filler. Filler candidates are typically the people that have hollows under the eyes or a fullness underneath and a deepening of the lower lid. It's not necessarily the people with the eye bags. It's tougher to mask an eye bag. The best thing to do for that is actually do surgery. Doing too much filler in this area can actually cause swelling and make the eyes look worse. So you have to go see someone who's an expert in the eyes to determine what the best solution is for you. I inject tear trough filler all the time and I feel very comfortable with it, but it's important to make sure that the doctor you're seeing and the type of anatomy that you have is appropriate for that type of procedure, because sometimes surgery might be a better option.
And how about if you're pregnant? Can you get RHA if you're pregnant?
That's also a very good question. So RHA filler, I don't perform in pregnant or breastfeeding patients. And that's the same as any type of cosmetic elective procedure. It hasn't been tested in this population. The risks are, in my mind, are just not worth the potential harm. And even though there haven't been any documented harm cases for patients who are pregnant or breastfeeding, it's just something that is best to wait until after you're done with breastfeeding and focusing really on the most important thing, which is raising your beautiful baby and breastfeeding them. And when that all of that is done, come into my office and we're happy to give you a little mommy touch up.
Okay. So here's another one. With previous filler injections, I was told that if I repeated the injections about every 6 months, that it would actually help to rebuild collagen long term. Is that true with RHA?
So there are different types of filler products out there. Other filler products that don't use HA but use different active ingredients can cause stimulation of collagen building under your skin. RHA works differently because it naturally mimics the collagen that's already there. So RHA, you don't need touch-ups every 6 months. One set of injections can last up to 15 months, which is the nice thing about it is it's one of the longest lasting fillers on the market. So instead of coming in every 6 months for filler, you can come in, once every year and a half or so for a touch-up. And there's other options that you could do concurrently with the filler to boost your natural collagen while still giving you nice movement of the face and preventing that overdone puffy appearance that a lot of people worry about with other filler products.
And let's see, how about this one? Would you recommend RHA for resting face, like wrinkles on the forehead?
That's also a really good question. So for wrinkles at rest of the forehead, there's a few different types of options. And typically with the upper face, what I recommend is Botox type of products. So these products are neurotoxins. So Evolus makes Jeuveau, which is the newest toxin on the market. Allergan makes Botox. These are just different names for medicines that work by reducing muscle activity and primarily in the upper face to reduce some of that resting folds that you have there that might be even worse when you're moving. So when your face is dynamic, those muscles become more active and those wrinkles in the forehead get more pronounced. For the lower face, what I typically do is filler products. So RHA collection is a great option for motion and wrinkles that form in the lower face. So examples would be the smoker's lines here, the marionette lines here, any type of tissue here that you're noticing wrinkles around and you want to fill it while still keeping your face naturally both at rest and in motion volumized. So all filler products do a great job at rest in the lower face, but the only FDA approved product for when your face is also moving with really nice results is RHA Collection. So it does both when you're moving and when you're at rest, but for the lower face. For the upper face, Botox is usually the way to go.
So we're getting quite a few questions that kind of have the same theme. So I'm going to summarize here a little bit. They're asking, what happens if you don't do a follow-up? Like if you get, one treatment and then you don't come back again and keep filling?
So the question is, if someone comes in, gets a treatment, and then doesn't come for follow-up. So typically when you get one treatment, it's a really nice result for about 15 months or so. So theoretically, someone can come in and just be seen by me once. We do the injection the same day. That's the beauty of fillers. It's a same day procedure. It can be done over lunch. And usually I like to see patients if they have any questions or concerns about 2 weeks after, just to see how things have settled, especially if it's after the first time they've ever gotten filler. But some of my patients don't want to come back because they're either too busy or they, it's hard to take the time out of the day. And for those patients, I usually say that's fine. Nothing happens. I'm here if you need me. So if you have any concerns, that follow-up is great, but it's not necessary. And many of those patients just end up seeing me in about a year and a half for their next touch-up.
Okay, so here's a good one. Do you treat and consult the same day? And do you numb before the injection?
That is a wonderful question. So the nice thing about RHA Collection is that it has numbing in it already. So there is numbing medicine that's part of the medicine in and of itself. When we're injecting the HA, there's already numbing in it. But I also pre-treat with a topical compounded facial cream. It's actually a really nice face cream that's pretty soothing, but it also contains active anesthesia agents in it. So while your skin's getting moisturized, you get a nice hydrating facial, you're also getting numb. So patients will come in about a half hour before their scheduled filler injection for my assistants to apply the cream. And then I come in and we talk and we do the injection. But the procedure can be done the same day. So if you come to see me for consultation, you decide that day that you want to get filler, especially if you give us a heads up over the phone and say, I might be interested in filler. They block enough time to be able to do that the same day, including the numbing. So we'll definitely be able to do that for you.
Okay, so I think we have time for one more question.
Okay.
And then, of course, the last question that everybody is asking is pricing.
Okay.
But before we get to pricing, can this be used to define a jawline?
Wonderful question. So yes, this product, again, it's one of the off-label uses that you have to find a surgeon who is an expert in facial anatomy, such as an oculofacial surgeon like myself, but it's a really nice use for this medicine. So you can actually define the jawline, which is a really nice use for both men and women. A lot of people want a more defined angular jaw or a more contoured jaw. And there's a specific type of agent that I use for that. It's RHA 4. It's the same type of RHA filler that I use to enhance the cheekbones and give a nice chiseled or snatched appearance. We can do the same thing to your jaw. So filler can be used in a wide variety of places, in the face and the neck even, like the previous question asker was wondering about, but you have to make sure that you get a qualified surgeon who's an expert in facial anatomy.
Okay, so now, of course, pricing, which is what everybody's dying to know about. So take it away.
All right, so that's a wonderful question, and it's very difficult to say exactly what the price would be without seeing you for consultation. There are a variety of different goals with fillers, so we try to stay within your budget for what your budget is for facial rejuvenation. So some people might just need a little bit, not even a full syringe for some lip enhancement or for some nasolabials. Some people require more filler volume in order to enhance their face to the degree that they need. So for deeper wrinkles, everything might vary in terms of the maximum amount of effect possible. So it's very good to come in for a consultation to discuss your goals, and also keep in mind that financing is also available. So we do offer Alpheon credit. It's a credit card that you use for aesthetic procedures. We offer it for our office for all of the cosmetic eyelid surgeries I perform, for Botox, for RHA, and it's I believe it's a no interest program for the first 12 months. So it's a great option if it's something that you want to pay over time.
Okay. And last question, just because it kind of relates, is do we use care credit, which we do also use care credit?
We do use care credit. That's a great question. Alpheon is also another type of aesthetic credit card that we have, but we have both available. So if you already have care credit, we accept that. And Alpheon is just a different version that has a more favorable rate for our patients because of the no interest. So we typically have our patients use the Alpheon, but we also offer care credit for those that already have it.
Great. So I think that's all we have time for. And
all right. So we have all of our questions answered. Thank you so much for joining me today and asking these great questions, tuning in for the live demo and the presentation. We probably didn't get to everyone's question, and I apologize. But if you have any remaining questions, make sure you text yes to the reminder that you receive, the text message that you receive, so that you can participate in a consultation with me, or to be entered into a raffle for a free filler treatment. We are giving a syringe away to one of the lucky participants. And in order to be eligible for that, make sure you text yes. So those are the best ways to get in touch with me. Call our office, schedule a consultation, and enter the raffle. And I hope one of you guys wins filler. It's in your area of choice. So I hope to see you all soon. And it was great to chat with you all tonight. And thank you for tuning in. All right. Take care, everyone. Bye-bye.